Today's guest is a medical doctor who utilizes the newest in natural and regenerative therapies to help people with all different kinds of medical conditions. And I'm so excited to have him here today, Dr. Mark Ghalili.
Thank you, Jesse. Thank you for having me. I'm excited to be here as well.
And congratulations on your new practice.
Thank you. Thank you.
I'm so excited that I get to be your patient.
Of course, we love having you there.
So you have a really interesting story. So obviously you're a doctor, but you had some personal experiences with something that kind of wanted you to go into this direction. Is that right?
I did, yes, absolutely. And it changed my career path kind of forever. I was practicing traditional medicine, you know, like every other doctor here in town, you know, writing prescriptions, you know, not really getting into the, you know, why is a patient having certain disease or why are they having a certain condition, rather than just masking them with a medication, finding the root cause of their illness and their disease and providing them with the right nutrients, supplements, and protocols that they need in order to help their cells and body thrive and get better.
So you're treating more of the whole, like, I mean, I'm a holistic health practitioner, I'm not a doctor, but like that's kind of the way that we go about it, but you do it in a much cooler way.
Well, I hope it's cool.
Well, you have all these new kinds of therapies and ways that you treat people. Like, do you want to tell us a little bit about, like, if I were to come in, what could I expect?
Sure. So what we do in our office, we have a lot of regenerative therapies. We work a lot with stem cells from your own body's tissue.
And who would that be good for? Like somebody with an autoimmune issue or?
Yes, there are currently IRB approved studies that we are currently conducting with our network for certain different type of autoimmune conditions. For example, you know, things like chronic fatigue, post-concussion or stroke recovery, used for a wide variety of different ailments, but it's specific to each patient to see if they'd be a candidate or not. We use a lot of other therapies such as, you know, peptides, such as other things that can cause growth for muscle and tissue and tendon growth, joint osteoarthritis in the joints, which is a huge deal.
So
a lot of patients have these conditions.
When you do stem cell, is it intravenous or do you actually shoot it into the actual area? How does that work?
So we can actually do both, but especially for osteoarthritis patients, we can, you know, provide them their own stem cells into their joints.
Wow.
Yes, for, you know, maximal recovery.
So cool.
Yes.
That's amazing.
Yes.
And I know that you have some experience in, like, I mean, there's so many autoimmune diseases. I feel like they're just popping up left and right. I myself have rheumatoid arthritis, so I'm always trying to do research on new therapies, new studies, what's happening and what can trigger them. And you had a personal experience with antibiotic Cipro. Because when I came to see you, you asked me, have you ever taken Cipro?
Yes.
And I said, yes, I have. I'm allergic to penicillin, so I think that was the common antibiotic that they would prescribe me. And there's a little bit of a controversy with this.
Yes, so I'm lucky enough to be here and be 100% recovered, but I had my own ordeal with the antibiotic Cipro. After taking it for a few days for a gut infection that I had, I ended up paralyzed, completely crippled. I was unable to walk. I had no muscle tone in my body, lost about 20 pounds. I was crawling to the restroom.
Is this a rare side effect listed, or is this not even talked about?
So it's not, I wouldn't consider it a side effect. I believe it affects everyone who takes the antibiotic, but everyone to a lesser extent. Once your body hits a certain limit or threshold of how much toxicity has occurred, that's when you get the onslaught of symptoms of what I experienced and what thousands of people that have reached out to me have experienced. So with my whole ordeal, I was unable to walk for months. Wow. Yeah, it was pretty much, board certified medical doctor, working at the hospital, working at clinics, unable to work, unable to care for my patients. And then I realized, wow, this is happening to a lot of people. I'm not the only one. So I found out a lot of support groups online.
Wow.
Yeah, and then being the only doctor in these groups was tough because, people think you're the enemy, right? So it was tough, but I had to learn everything on my own, and I did every sort of treatment you could think of. Natural, alternative, regenerative therapies. There's really no answer in the traditional world for me. It was just going to be, here, take some ibuprofen or take some steroids for your pain, which in reality would have made my condition, 10 times worse on a much higher level. from what I've seen in my experience of speaking with patients and seeing what is triggering their reactions.
Wow.
So after I did all these regenerative therapies, I slowly started getting better. I got on natural supplements. I figured out the right way to help rebuild the mitochondria, to get rid of the toxins in the body as well, which is very important. So I then started setting up a protocol of all the new different cutting edge medical technologies. And I said, wow, I can really help a lot of people with this because I had to go through it myself and figure out, how am I going to get better? How am I going to get out of this wheelchair? Every day I woke up, what do I need to do to get out? I can't live my life like this. I was young. I mean, and,
You're still young.
I was 31 years old, just
Yeah.
like, kind of starting, everything, my practice, and everything was taken away from me in a split second. And I started having hundreds, if not thousands of people just reaching out, telling me similar stories.
Wow.
And then I realized this is an epidemic.
Wow.
Yes.
I mean, I love that, there really is something to say about you being a medical doctor, but having the compassion and going through something like that yourself. You can't learn that in school. And I think it's going to be an amazing practice. You're able to help so many people with all different types of ailments.
Thank you.
Yeah.
Thank you.
I'm so excited.
Yes. I didn't ask for this, but it kind of just happened to me, and it changed my whole career path.
Right.
So now I'm just focused and determined to help, other people, not only with my certain condition, which is a small portion of my practice, but with any type of debilitating condition that traditional medicine doesn't have an answer for.
Right.
A pill is not always the answer.
Right.
It's a whole body and lifestyle change, and giving your body the right micronutrients, getting rid of the inflammation, for example, with things like rheumatoid arthritis, modulating the immune system the best way we can to help the body heal itself.
Like I came into your practice and we did lymphatic drainage, just like kind of for fun to try some things out. What other things are you doing? What's some of the new stuff that's happening?
So we have a state-of-the-art FDA cleared LED laser bed that's reducing inflammation. It's increasing, we see it's increasing the patient's mood. They're feeling a lot better, a lot more energy. Studies have shown that, LED lights can increase stem cell production as well.
Wow.
So these are part of the new cutting edge technologies that we do have. We do a lot of different, peptide creams, gels to use that can get absorbed in the body to help rebuild and heal muscles and tendons. We do a lot of different IV infusions of any vitamin you could think of in different concoctions to help patients recover, feel better, and give them the nutrient support they need to help their cells thrive.
And I know even when I was there was a woman that had flown out just to have you help her. And
yeah, unfortunately, with a certain condition, with Cipro or with certain antibiotic toxicities, there's really no doctors recognizing this in the community. So I really want to take a stand and be one of the few physicians that are acknowledging this, that we have to believe our patient.
Right.
My patients come from all over the world, and they all tell me the same thing. No one believes me. I'm a woman. They think I'm crazy. They want to put me on antidepressants. But if you really listen to them, why would anyone want to, you ask them questions. They can't go on vacation anymore. They're not working anymore. They lose their husbands. Why? Why would anyone in their right mind just want to come make that up and do that? So you have to start listening to them and giving them the benefit of the doubt and start doing the research. When you start doing the research on these things, it's actually pretty common.
Right.
And it can happen it can affect anyone. Not to the extent that it affected me, but there are thousands of people that were affected as much as me, and there's multiple communities online kind of discussing this. If you actually look at the data, certain diseases like chronic fatigue syndrome and fibromyalgia.
That's what I was just thinking of, was chronic fatigue syndrome.
Yes. So chronic fatigue syndrome and fibromyalgia, if you look at the statistics, it's around, from what I read, around 12 million people just in the United States alone have that diagnosis.
Wow.
If you look at the data, it's in about a 5-to-1 ratio of women having this condition compared to men. If you look at the data of the Cipro usage, it's prescribed in a ratio of about 5 women to every 1 man, because it's commonly routinely prescribed for urinary tract infections for women. This is why when a woman comes to my office with, doc, I'm tired, I'm fatigued, or I've even an autoimmune condition, you want to ask them if they've taken these sort of antibiotics, any type of antibiotic specifically, but These specifically can, wreak havoc on the gut lining, which can then also lead to autoimmune issues and inflammation throughout the whole body, because now you have a leaky gut and now you're getting this autoimmune cascade occurring. So when it comes to chronic fatigue syndrome and fibromyalgia, that's the number one question I feel doctors need to start asking their patients. And once women start, raising awareness about this, and I've had doctors ask their patients with chronic fatigue and fibro, hey, have you ever taken Cipro? The overwhelming majority of the patients say, yes, I have. And then my symptoms started after. I can't exercise as long. I'm fatigued. I'm tired.
Wow.
Yes. So I think it's a big key, and it needs to be addressed by physicians all over the world.
Well, I personally have 3 of my best friends dealing with mysterious illnesses that are young and healthy. And it really makes me wonder, a lot of them gravitate to me because they're like, do I have rheumatoid arthritis? What's happening to me? But it's really interesting. I mean, there's all these new things popping up. So I think we do have to look at the person as a whole and really dive in and see what's going on.
Absolutely. That's the number one thing. We don't just treat one part of the body. You have to treat the whole body in order to heal properly. And that's what I had to do for myself. I learned that the hard way, going through my ordeal and what I went through. And it's just paid off. And, I'm blessed to make 100% recovery from my condition and to be able to share my knowledge with other people, not only for my condition, but really with any debilitating disease. It's a very similar, we do similar type of protocols for everyone.
And the name of your practice you just opened?
Yes, Regenerative Medicine LA, as we're located here in
Nice.
the beautiful city of Los Angeles.
And I always ask my guests, I'm going to ask you, what if, just right off the top of your head, first instinct, what is your golden secret?
My golden secret, vegan.
Ah, I like that golden
Yes.
secret. Did you become vegan after your
I did. Yes.
experience? Yeah.
I did because if I'm exposed to any type of antibiotic in meat or steroid or hormones, it could have a potentially,
Trigger.
it can potentially trigger. So I just, want to avoid that all in general. And I just eat clean, healthy. I feel invigorated. I'm energized every day.
I love that
So, yeah.
golden secret. I read this quote. It said that people living with autoimmune disease are the healthiest in the world because they have to be.
Yes.
And it's so true. Like when you experience something like that, it just keeps you in line and, really makes you make healthy decisions.
Yes, absolutely.
Thank you so much, Dr. Ghalili, for coming.
You are very welcome.
Yay. I'll see you soon, too. I'm going to try out some of your new things you got going on.
Come at any time. No appointment needed.